Alright, I'm going to make this short and sweet. With regards to the Vata expression of bloating, difficulty with sleep, skin rashes of the winter, I think there's a couple things that we can suggest to my patients to get through until springtime. And most of my patients that I term Vata, and you can look up what Vata means on the Chopra.com website. The idea is that during wintertime, when everybody's pressed for schedules, overscheduled, or just can't find the time to do anything, at least if you have one exercise routine that you rely on, whether it's twice a day, at the beginning of your day, at the end of your day, or just right before you sleep, not much to ask. And I have a lot of patients that just don't have time, and I have challenged them by saying maybe 7 minutes before sleep, try some breathing exercises. It's not like getting into a gym and doing some cardio, but at least will be enough to work on breath. And for those of you who do breath meditation with me, you work on breath, you release serotonin. When you release serotonin, I believe there's more of a lasting effect with serotonin than there is with endorphin. So if you go exercise, you get an endorphin rush, it lasts for about an hour, you feel good. If you meditate, if you work on breath work, you actually get a serotonin rush, well, not as aggressive as endorphin, but the serotonin increase lasts for, I believe, a lot longer. And again, if you've watched any of my videos, you know that serotonin comes out with Prozac, Zoloft, and Paxil, but if you want to avoid those medicines, hey, just do some breathing exercise. Anyway, we're going to start with 3 poses. The first one, I'm not going to use the Ayurvedic terms or the yoga terms, we'll just show you what happens. So while you're say in bed, waking up or going to bed, the first pose will be a seated pose. You work on extending upward, and then you slowly, while keeping your axis high, as you exhale, come down, and you just drop the hands to wherever they meet. If they happen to meet the balls of your feet, great. If they're at the ankles or the knees, that's fine too. But you gently relax, trying to keep the imaginary line from the root or your sit bones up to the crown of your head in a, I guess, accentuated or straight line. And you try to take a breath in and extend through the crown, and then exhale and soften. Those of you who do yoga, you know to always extend out and soften with the exhale. You eventually get to the point where you can put your nose to your knees. It's not necessary. The idea is that you're just holding the pose for 5 breaths in and out. After the 5th breath, you slowly work your way up, and you're finished with your first pose. Second pose will be you flex one leg, keep the straight leg going forward, and you bend the other leg to a comfortable degree. You try to sit at about a 45-degree angle now, and you again lift up, but this time you're coming at an angle. And then you get to the point where you hold, you're comfortable with a little stretch, and the idea would be to open the chest, sternum, or heart chakra to the other side. You hold that comfortably, and you do the 5 breaths in and out. Every time you take a deep breath in, you extend as best as you can with the fingertips, and as you breathe out, you soften. Try not to pull too aggressively, and then you do the other side. So you've done 5 breaths this way, 5 breaths this way, another 5 this way, and finally, as you're ready, if you're getting up in the morning, I'd like you to get into something called a warrior, Warrior 2. It's when the front foot, knee is over the ankle, toes are facing forward, back foot, legs are straight, but the toes are facing about 45 degrees in that direction where the body's open. Usually the hips are canted in this direction, and the arms are straight out. And this is Warrior 2, if you want to call it anything. But you just hold the pose, and every time you take a deep breath in, you stretch the fingers out in opposite directions. And when you exhale, if you can, you soften, and if you can go deeper into the pose, great. Obviously I'm using support of this makeshift bed. Deep breath in, chest out, exhale, soften. And if you can only get to the point where you're like this, that's okay. But still, you go in opposite directions, chest out, and then soften with your exhale. The idea has, you'll see in my other videos, and you do the other side. In the other videos on breath meditation, you always try to inhale over the course of 4 seconds, you hold it gently, then you exhale over the course of 8 seconds. Andy Weil, one of my teachers in the University of Arizona, does 4-7-8 breathing. You can look up that video. But when you do the breathing exercises and you do those 3 poses, that would be one with both feet forward, one with knee bent, one with the other knee bent, and then the 2 warriors. That's about 7 minutes. In 7 minutes, if you're finished, perfect. Serotonin's up. You're either ready for bed or you're ready to start the day. If you start in the morning, I would start with what we talked about here. If you're ending your day, I just do the opposite. So you start with the warriors, then you go down into leg flex, then you go down to forward fold, and then you're done for bed. So give it a try. Try to maintain that for 21 days straight, and hopefully the rhythm of what you do will be easy to continue, and you'll see your body wants to do more, and then you can kind of daisy chain from that point on and do or investigate other possibilities to involve yourself in more exercises